Hi, this is my interview with Joslyn Dias. I'm going to ask my first question now. So my first question is, describe your job. How did you know you wanted to work in the department where you are now?
So I am a nurse at Kaiser Permanente. I've been a nurse for 13 years and I work in labor and delivery. Describe my job. Every day varies. So depending whenever you show, there's multiple roles in labor and delivery. So whenever I go on shift, there's an assignment sheet and then I pretty much show up and I get my assignment. I can have a labor patient, I can be in the operating room, I can be in triage, I can take care of postpartum patients. So it varies every day. So that's the fun part about my job because every day is different.
Okay,
Do you need more?
that's it. Okay, question 2. If you could, would you switch to a different medical department than you are in now? Why or why not?
So the nice thing about Kaiser is they do provide, they want their nurses to excel. Right now they're trying to become magnet, which is a certificate that hospitals get to be recognized for providing excellent care. So they really encourage the growth of their nurses. So they support nurses going back to school. Eventually, once my kids are a little bit older, I have goals to want to try to get my master's as a nurse practitioner. So that would be my next step to change. I would never change my department or unit that I work on now as a staff nurse, but just going up the clinical ladder.
Okay, question 3. What are some common medical terms that you use daily?
Common medical terms are working labor and delivery is like, we check cervixes, so like, a laboring patient, they are 0 to 10 centimeters, so you're always doing exams. Providers are always asking like the station of your baby, like how high up to the pelvis, what the dilation is. Effacement, that's another terminology, that's the thickness of the cervix. That's used a lot. What other terms? There's so many different terms that we do use, but that's like the most common. Like everybody is always asking that.
Okay, 4th question. What skills, both medical and personal, are most important working in your field?
So medical skills, we do multiple skills. So you're always putting a patient on the monitor. We do Leopold, so filling the baby to fill what position the baby is in. We do a lot of IVs. I can put in like 5 IVs a day to patients, depending. Like if they're triaging, we admit them, do all their questions, put IVs, and then we hand off to their nurse. We also place a lot of Foley catheters because a lot of patients now for pain management in labor, they get epidurals. So we put catheters in them because then they're numb from about their belly button down, so they don't get the sensation to have to pee. So we have to do that. And then obviously in the OR we have, in the operating room, everything is sterile. So just understanding sterile technique and making sure everybody is following the sterile processes in the operating rooms to keep infection control down.
What are some personal qualities?
Personal qualities is just being personable with your patients. Labor and delivery is very vulnerable, so you want to like your patient to feel comfortable, and just making sure that to let them know that that's their space, wherever they are in the labor room or in the operating room, and just feeling comfortable to speak out with any needs or requests. And just we do this every day, but in labor and delivery, patients, you only get so many times in a lifetime to have a baby, so you want that memory to be positive for the patient.
Okay, 5. What is the most rewarding part of your job, and what is the most challenging part of your job?
So one of the most rewarding parts is we get to have birthday parties every day. That's the fun part, right? You get to help coach moms, especially like first time moms. just seeing their like reactions, you know, as they welcome their new baby into the world, is like one of the best things ever. One of the most challenging jobs is in labor and delivery. You have to be very assertive. So we're always assessing like the fetal heart tones while the mother is laboring. We continuously monitor the baby's heartbeat. And labor is stressful and stressful for the baby too. So we have to make sure that the baby is tolerating labor, and sometimes we have to do interventions to correct the responses to the baby. And sometimes that requires notifying your doctors, and sometimes providers, they like to push back a lot. So you just really have to like be a patient advocate for your patient and tell like your doctor like this is what you want. Like you kind of give your recommendations to them. Yeah, probably just learning. Yeah, just edit that part.
Okay, 6. What equipment or technology do you use most often?
Equipment. So the equipment we use every day, I mean, for a laboring patient, is our electronic fetal monitoring. So that's what we place on the mothers when they come in to assess the baby's heartbeats and their contractions. So every patient usually has that unless they're very low risk. You can sometimes Doppler just listening with a monitor for like once an hour, but the continuous fetal monitoring is what we use most frequently.
Okay. What are some common medications used and what are they used for?
So one of the most common medications in labor and delivery, we don't have a lot of medications we use in labor and delivery, but one of the most common is Pitocin. So Pitocin is a medication that causes contractions. It's a prostaglandin that contracts the uterus. So when patients come in and for an induction, we can use it at low rates. And then after delivery, everybody gets Pitocin to contract the uterus, because once the placenta is delivered, all those vessels are open. We want the uterus contracting well so that that decreases the risk of hemorrhage. So everybody gets Pitocin after delivery as well. And then there's 3 other medications that we use if patients are hemorrhaging. Misoprostol, that's also prostaglandin, that's a tablet. Methergin is an injection, and Hemabate is also an injection. Those all help to contract the uterus, so decreases the risk of hemorrhage.
Okay.
Uterotonics, they're called uterotonics.
8. How do you accurately document patient information and why is it so important?
So we have 2 systems that we use. We have our electronic fetal monitoring, so it's an app called Centricity. That's where we monitor the babies, so we can continuously monitor, just like a telemetry monitor for adult. That shows us the contractions and then the fetal heart rate. And then we have our electronic medical record, which we use Epic. And that we can, once the patient comes in, presents to our unit, they give us their medical record number, we can pull up their chart, so it pulls everything, like shows all their history, all their visits, everything is within that system. So, yeah, we use that. What else do we?
And why is it important that you document this information?
Oh. The reason why it's very important is because labor and delivery is a very high risk unit. Things can go wrong, and when they go wrong very quickly. And you want to make sure you're documenting accurately and within real time. So meaning when something's happening, you want to make sure you document it as close to that time as possible, because sometimes when bad things happen, then there becomes legal issues where they get sent to court. And when they pull those medical records, you want to make sure the charting is within timely, because sometimes lawyers and stuff, they like to try to assess why you weren't charting within a time, or did you go back and add that because you knew that this was going to be a problem later. So just real-time charting is the best way to practice. And practicing whenever you do chart, like always chart that the same way, because if that way, you know, patients in labor and delivery, a lawsuit can occur. I think parents have until 18 years of age, and I think the child can sue within 25 years of their life. So, I mean, you're not gonna remember what happened 20 years ago. So you wanna make sure, like, you have to paint a picture for yourself, so that if you ever got pulled into a legal dispute, that you can speak to it.
Okay, question 9. How do you support patients who are scared or nervous?
So just really educating them about the whole process. Labor and delivery, especially a lot of first time moms, they're very nervous and anxious. So just being good at educating your patient, explaining to them what the routine will be, what to look for, so that they can mentally prepare, and just being a good coach for them, and like staying positive for them, so that it helps to relax them. Usually, like if I have a very anxious patient, you kind of want to find something that you can relate to them about. So, you know, like in the operating room when patients get nervous, we always ask them, we always have music playing in there, so we always ask them, like, what's your favorite, like, what do you like to listen to, country music, whatever. So we try to put that on, you know, to distract them. We use little distractions, and then just finding what is comfortable for them. We try to like let them be involved in their care too, so that it helps to make them more relaxed and comfortable in their environment.
Okay, last question. What personal qualities do you think make someone successful in the medical field?
Personal qualities is just being a good team player. Labor and delivery, you have very good teamwork, because when things happen, you need a lot of hands on deck real fast. So just, you know, if something's happening on the unit, you see, like, just go and check in with your coworker to see if they need help or anything, if you need to grab anything for them, or a doctor, and just making sure that we can safely provide care to the patient. And what else was the question? Sorry.
Personal qualities that make you like better in the medical field.
Okay, and then just being very adaptive, and you know, things change very fast. So knowing how to handle them and stay calm yourself and not stress, because you know, you don't want the patient to feed onto that, and you want them to know that, like, okay, I can handle this situation, I'm here to take care of you, so that they feel comfortable and safe. And also I was going to say is assertiveness in labor and delivery, being very assertive, not whenever we call using your cuss words. So usually you tell them, like, okay, I'm concerned, I'm uncomfortable, and this is a safety issue. So just being comfortable and knowing when to stop the line.
Okay, that's all the questions I have for you. Thank you so much.